Well, as Gauteng continues to be the epicentre of the country's third wave, there are worries about the province's ability to cope with the exponential rise in cases. eNCA's Manqoba Mchunu is speaking to Gauteng authorities today on what the plan is for the coming weeks. Manqoba, thanks so much for joining us. You're on the ground there. What's the sense from health authorities about Gauteng's ability to cope?
Well, Annika, certainly a lot of concern in terms of how Gauteng is doing currently with COVID-19. Of course, the province is still the epicenter of the virus, with over 7,800 cases reported in just the last 24 hours. And of course, it is quite a huge concern for many of the healthcare workers here in this particular province. We're speaking of people that need to be hospitalized. We're speaking of active cases that are up in the province. And just looking at that, in terms of the active cases here in Gauteng, just 2 weeks ago, Annika, we were looking at just 19,000 people that had been infected, that had COVID-19, the cases that were active at the time. But that number is now ballooned to over 51,000 active cases in the province in just a space of 2 weeks. So it just does tell you how dire the situation is here in Gauteng. And of course, I'm going to be speaking to the unions in terms of how the hospitals are doing, how the healthcare workers are coping with this particular third wave of infections here in the province. But in terms of the national number as well, Gauteng now accounting just for over 60% of daily new cases that have been reported in just the last 24 hours. But joining me now, Annika, to discuss this is Bongani Mazibuko, who's from DINOSA. He's the DINOSA Gauteng Provincial Secretary. Thank you for your time, Bongani. Let's start here. Of course, the picture and the numbers not looking too good here in Gauteng at this particular point. Are you worried at DINOSA?
Thank you for having me. Yes, we are definitely worried as DINOSA about the state of affairs at the moment. And this has made things even worse. The fact that Charlotte Maxeke is still closed, and we've seen an overburden even before the onset of the third wave, whereby Helen Joseph and Rahima Musa were struggling with the numbers of patients coming in. Now, with this onset of the third wave, things have gotten even worse, and now we're seeing a lot of people, particularly nurses, who are at the forefront of this, being affected and not being able to cope with the number of patients coming in.
7,800 new cases in Gauteng alone. Surely that's very concerning. What are healthcare workers saying to you in terms of how they are coping in hospitals?
They are definitely struggling, because now if you look at it, it means that you've got people who must still offer the vaccine plan, which is supposed to be ongoing, and then at the same time you've got an influx of patients who are testing positive, and those ones who need hospitalization as well. And from the private sector as well, we've been told that the private hospitals are almost at capacity. Now it means that there's going to be an even more burden on the public sector hospitals, and I'm not sure where we're going to get the beds for.
And what are healthcare workers telling you in terms of beds, the capacity of beds in this hospital, the pressure that they're certainly feeling? Are there more admissions that they're seeing? Are they worried that perhaps we're running out of bed spaces?
We're already running out of bed spaces because, as I'm saying, hospitals like Rahima Musa, we had people who were pregnant and in labor sitting on benches waiting for beds. And now that doesn't even give them enough time. So with that compounded with the influx of patients that need to be admitted due to COVID, the system is not coping. And I'm worried we are worried as DINOSA about that impact of that on the nurses themselves, because that's why you're going to start having burnout and people not being able to come into work. And the private sector is using overtime, so people don't get to rest. They end up being at work for almost 7 days just to make up the numbers.
And just finally, government's response to this, are you happy so far? Do you think that there's a plan?
I don't think there's a plan. Right now, it's like we're just reactive. We're not planning properly. We knew that the third wave was coming, and we knew that it was expected to be around this time, but there was no proper plan in place to say how are we going to deal with it. And with the closure of Charlotte Maxeke, we should have had a proper plan to say that in Gauteng this is what we're going to do, because we knew that we already have a whole lot of beds that is a deficit, and Nasrec has been closed. So what is our plan? nothing has been communicated to us. If those questions could be answered, then maybe it might give us a share of light to say what is the proper plan that government has in dealing with this pandemic.
Okay, thank you very much, Bongani Mazibuko, who is DINOSA's Gauteng Provincial Secretary, of course, raising some of the concerns that they've had as unions with regards to the third wave. Of course, they feel that we're not quite ready in terms of dealing with the third wave of infections here in Gauteng. Of course, other issues that remain a concern is the issue of staff shortages and also a lack of equipment at some of these particular facilities.
Manqoba, just to give us an idea for people in other provinces, I remember when we were peaking in the Western Cape, there was a sense of real anxiety and dread, and people started changing their behavior. What's the feeling like on the ground, especially socially, and if people are staying at home, are they still going out, are they masking up?
Well, Annika, I think here in Gauteng, I mean, many of the people are simply not complying with COVID-19 regulations. I mean, if you walk around here in Johannesburg, you find many people that are not wearing masks, that are not adhering to social distancing, and it is quite a concerning picture. In fact, it's one of the concerns that have been raised by authorities here in Gauteng to say that people here in the province are simply not complying. They're still gathering, there's still massive gatherings that people are attending, especially during the weekends, and that's what officials are actually attributing this increase in the number of cases here in this particular province. So it doesn't seem like a lot of people are complying, and in fact I remember last week just speaking to the Gauteng Premier. He says, of course, that they felt at the time that even level 2 regulations were not quite enough for Gauteng because many people are simply not complying. So it is quite a huge concern here in Gauteng when you look at how people are responding to this particular third wave. It doesn't seem at all, Annika, as if people are taking this seriously.
Thank you so much. That was eNCA reporter Manqoba Mchunu.